Most of us have tried it at one point or another, and usually without success. We're talking about dieting, and today we take a closer look at why diets fail. Andrew Rodican, founder and associate medical director at Medical Weight Loss Centers in East Haven, is back with us. Welcome back. Thanks for being here.
Thank you. Thanks for having me back.
It's scary when you think about the numbers that obesity, you say, is now the #1 preventable cause
of death in the United States,
US.
Surpassing tobacco smoking.
300,000 people this year alone?
64.5% of Americans are either overweight or obese. And basically 30% of Americans are obese.
And those numbers only expected to rise.
By 2030, those numbers are expected to double.
So when you think about all the technology that we have and diet aids, unfortunately many of them do not work, why have we not been able to come up with a solution for people?
That's a great question. Why is it that physicians can cure cancer, we can do phenomenal things now, but we can't treat obesity, the #1 cause of preventable death in this country? Well, the simple fact is we're not trained as healthcare professionals to treat obesity. We're taught the patient comes in with high blood pressure, high cholesterol, go on a diet, see you back in 6 months. If you don't lose the weight, I'm going to put you on a pill.
And diets usually only result in short-term weight loss.
Exactly.
Because most people, when they diet, are losing muscle mass and not losing fat, which is what we need to do in order to maintain that weight loss, right?
Correct. This is lean muscle mass. This is the only tissue in our body that burns calories. And this is 5 pounds of body fat. Okay? So if you lose muscle, you're going to lose metabolism. Eventually, as you're dieting, you'll lose weight because muscle is weight. However...
And muscle typically weighs more than fat.
Exactly.
Okay.
So when you step on the scale and you're losing weight, all of a sudden you stop losing weight and you're like, wow, I can't lose any more weight. Then you gain weight back. Do you think you gain back this or do you think you gain back this?
I'm going with that one.
Exactly. That's called the Michelin Man theory.
Oh.
We get less muscle, more fat, slower metabolism. We're set up to fail.
We were talking about earlier, visceral fat, and that's where the danger comes in. There are lots of health problems associated with that.
Correct.
You have another prop.
Right. Well, there's the classic apple shape where people have belly fat.
Right, or pear shape.
The pear shape. So this is an example of the apple shape. Notice that there's a darker yellow fat in the middle.
Yes, I see that.
And then there's subcutaneous fat on the outside. This visceral fat wraps around our body's organs, our intestines, our pancreas, our liver, and squeezes everything and causes the problems. If you think about someone who's a pear shape, their fat is in their thighs and their butt. There's no organs down there. So it doesn't cause as many problems as visceral fat does.
You say the majority of your patients, I want to get this right, you say being overweight is a symptom of a chronic medical illness, which is often inherited and will never go away. Explain that.
Well, first, the inherited part. If both of your parents are obese, you have a 60% chance of being obese. But it is a symptom of a chronic medical illness, just like diabetes. If you came into my clinic and you were having symptoms of, excessive thirst and you were losing weight and not trying and excessive urination, those are symptoms of type 2 diabetes. I can fix those symptoms in about 2 or 3 days. If you don't continue to treat the underlying illness, the diabetes, your symptoms are just going to come back. So when people lose weight on a typical weight loss program, they're only treating the symptoms.
So typically, what's the underlying cause?
The underlying cause, in a nutshell, is too much production of insulin. According to the Cecil Textbook of Medicine, which is our Bible in medicine, fasting insulin levels are the critical difference between thin and obese individuals. That's a quote right from the Textbook of Medicine. Why physicians don't know that, I don't know. But we as bariatricians, who are medical weight loss specialists, we don't do surgery. The term bariatrics was actually coined by the American Society of Bariatric Physicians over 50 years ago for medical treatment of weight loss. Everybody thinks of bariatric and associates the term bariatric with surgery. I've had a husband and wife lose over 300 pounds in our program in less than a year. So those are bariatric surgery numbers without the scars and the risk.
So what do you recommend as the healthy way to lose this weight and maintain it and keep it off? I mean, it's not to boost your muscle mass and to burn fat.
Good question. If you were to go on a 1,500 calorie diet based on the food pyramid, most of us need 81 grams of protein to maintain our muscle mass. If you followed the food pyramid, you would only be getting 61 grams of protein on a 1,500 calorie diet. So food, protein, carbohydrates, fat. We don't give you enough dietary carbohydrates in our program, so you can't burn sugar. We give you enough protein called optimal protein so your body cannot take protein from your muscle. Your body needs protein to break down to amino acids to do a variety of functions, and we limit your fat. Your body is basically forced to burn fat for energy and preserve lean muscle mass. So when you're done, you've preserved your muscle mass, your metabolism stays high, and the body fat is gone.
Well, listen, if you want more information, you can contact Medical Weight Loss Centers, or you can just come to our website, WTNH.com, and click on the Connecticut Style link. There's all the information for Medical Weight Loss Centers. Andrew Rodican, thanks for being here. Once again,
Thank
we
you.
appreciate
Thanks
it.
for having me.